Time is running out. Oregon healthcare workers are under a mandate to be vaccinated against COVID in less than 2 weeks from now. But tens of thousands of Oregon nurses could lose their license if they don't comply. Lisa Balick looking into this. Lisa, I know you talked to members of the Oregon Nursing Association about the mandate, but you also talked to them about our current nursing shortage that's already been underway.
Yeah, and they actually have some concrete ideas of how to solve that, what they want to see done both on the state and the local level, as fatigue and burnout is really taking its toll on the nurses.
Was seeing the despair on the nurses' faces and the fatigue, and it's more profound than I've ever seen that.
Nurse Matt Calzi is stunned by what he found when he went back to work in an ICU unit after taking a break from hospital care, seeing what the nursing shortage really means.
When you double a nurse's assignment, you double their workload, then things don't get done. So while I'm on break, there's things piling up waiting for me when I get back, right? Like medications that may need to be passed, contact with family members, reaching out to physicians, all sorts of things. And then I tell that person they can go on break and I watch their patients, and we just keep compounding it.
It's why the Oregon Nurses Association is calling on hospitals and healthcare systems to add back staff, provide incentives, retention pay, and to not rush back to maximum capacity until there are more nurses. But there may be even fewer soon. The State Nursing Board meeting next week to decide whether to punish nurses who are not vaccinated against COVID. All healthcare workers required by the governor to be protected by October 18th. It could mean suspending or even taking away nursing licenses, perhaps fines. The Oregon Nurses Association says at least 90%, though, of its 15,000 nurses are vaccinated. But 65% of healthcare workers in Southern Oregon are not vaccinated against COVID. The ONA wants state funding of mental health programs for nurses who often work 12-hour shifts. They tell us taking time off isn't easy to do. They worry about their coworkers.
We don't want to see our coworkers suffering the way we would if we were short-staffed. So we feel this need to go into work when we're already so exhausted.
Now, I took a look just a little while ago at the Oregon Health Authority's website where they update the numbers of healthcare workers by profession to see how many are vaccinated. It has not been updated since the beginning of September. I checked in with them. They say, well, we'll have an update next week. We will be following that, that's for sure. Live in downtown Portland, Lisa Balick, KOIN 6 News.
Yeah.